But it's the other way around. Most of the patients who have primary vitreoretinal lymphoma will go on to develop CNS lymphoma. So you must remember that. So it's your responsibility to get them tested for CNS lymphoma, and perhaps not the other way around, and keep them followed. Now this, I think, very briefly, she has been exposed to this patient by Dr. Vishali. And you can see this is a 65 years old lady, and she already has this looking, we don't know what it is. Okay, it looks like some kind of a retinitis pigmentosa. And this lady, again, we had a challenge, and we thought we will, and this just to show that within 3 days, these deposits are moving around. We were trying to do some funny things, making a line on the right side and left side. We were trying to see, if these cells would move around in the subretinal space, and actually they were moving, they were mobile, and this is what it shows here, if you get it. Okay, and she's shown this angiogram, so very classic of the vitreoretinal lymphoma. Of course, the cytology gave the diagnosis. And now this time we did get an MRI, and which did show that there was the primary CNS lymphoma associated at this point of time in this lady, and she also received external beam radiation as well as the intrathecal methotrexate she received from the Department of Neurology. And you look at it, both eyes look the same now. So the question here is was this representing a spontaneously regressed B-cell lymphoma? Because after radiation and treatment, it looks exactly the same. So this I have said already, and I'd like to sum up and say that many of these patients are confused with infectious uveitis. There is always a delay on an average world over, because there are not too many of these cases going around, but I believe in the last USI meeting they already got the first prize in a poster presentation from the department, which represents, I think, these 12-13 cases in the last 4 years or 3 years, and that means we saw in the previous 20 years 12-13 cases which we, I think, published a couple of years ago. And another 12 or 13 cases have come in the last 2-3 years. So probably our index of suspicion is improving, or maybe these cases are now getting more frequent. And must remember that any patient, as I said, who is not responding to your conventional care, don't hold on to those patients. Don't hold on to those patients. Pass them on to the next higher person or center. Thank you very much for the opportunity. Thank you.
Thank you, sir, for a very informative talk. I am sure it is an eye-opener